Hi, it's Maria, Future Psych NP, and today we're speaking about Unit 3 Urinal, about a time that I have encountered a patient with suicidal thoughts, or that they feel like they want to kill themselves and their people are better without them. I have worked in the mental field, substance abuse, addiction world for about 10 years, and that's something very common. I have had patients that actually do want to kill themselves because they're very depressed, they're very hopeless. And then I have patients that just use that as a manipulation. So, one of the patients that recently caught my attention, his name was 58 JC-year-old male, bipolar, schizophrenic. He appeared fine. He was fine. He was being medicated. And then one day he was in his room and he was reporting that he wanted to kill himself. When he said that, we went in the room, we tried talking to him, but it got to the point that he said, if you guys come in my room, I'm gonna cut myself. So it needed a lot of intervention. It needed the cops to come Baker Act him. But something that I feel helpless with was that when the cops took him to the hospital, he was assessed and everything. He was sent back the same day. And that's something that's happening a lot with Baker Acts in hospitals now. The patient's getting Baker Acted, the doctor is seeing him, and the doctor is reporting that he's fine and that he doesn't need any help. Like he doesn't have any criteria to be Baker Acted or to stay in a hospital. Back in the days when we used to Baker Act someone, they wouldn't come until the 72 hours. So I don't know if it's because something like psych hospitals, like there's not a lot of psych hospitals anymore, and a lot of psych hospitals have closed. So maybe that's why the Baker Act world has changed. But I feel like if a mental provider is reporting to another mental provider, I don't feel like this patient's safe and he needs medical help and psych help, and he needs to be at an inpatient hospital for more than for more than 24 to 72 hours. I don't believe that has changed. So that's something I feel very helpless with, and that is an issue that we've been experiencing a lot lately. Thank you, and hope to see you in uniform.